I'm Rachel Meyer. I'm the Director of Policy and Government Affairs for the American Society of Nephrology. And just want to echo my gratitude to Richard and Paul and Diana and Aaron and the team for pulling all of us together and inviting us to speak on this important topic. As Rob alluded to, there are a lot of others in the room who've been working on the issue of immunosuppressive drug coverage for much longer than I've been at ASN. So just a quick shout out to Troy, Peggy, Bill Applegate, who's not in the room, and others. There's a lot of collective wisdom here. And it's exciting to see our community united on this front in getting this bill across the finish line. So the topic of my topic is where are we now? And I think we are at a moment of unprecedented opportunity to finally get this decades-old policy challenge across the finish line, really in the coming months. So I'm going to talk a little bit about the context, where we are in terms of this administration and its unique focus on kidney care issues. Rob alluded to one of the challenges that we've seen in the past is kind of Congress getting out of its own way to get legislation done. So coming in the context of an administration that has a really unique and personal focus on kidney care issues can help to overcome some of that aspect of the barriers. We've recently, I'm going to talk a little bit more about this, gotten a confirmation from two credible sources in the government that this bill will actually now save money, something I think everyone in this room has known for a long time, but we've never had an official confirmation on that front. There's continued collaboration across, sort of on a bicameral and bipartisan basis. And there's broad agreement in the kidney and transplant community. We're all working on this together. And I think shared sense of urgency up and down Pennsylvania Avenue, sort of across both chambers and throughout everyone in the room here today and the broader community. So, as many of you are aware, the Department of Health and Human Services leadership has a number of very personal connections to kidney disease in general and to kidney transplantation in particular. So Secretary Alex Azar, shown in the center of this slide, his father was actually on dialysis. He did hemodialysis, he did home dialysis through peritoneal, and ultimately received a kidney transplant from a living donor. So this is an issue that's really near and dear to his heart and something that he is personally prioritizing work in the Department of Health and Human Services on. To his left, you see Adam Bowler, who's a senior advisor to the Secretary. And Adam's aunt, and this has all been shared publicly, so there's no HIPAA violations going on here. His aunt was also on dialysis. And then Admiral Giroir is co-leading, together with Mr. Bowler and the Secretary, the development of an HHS-wide kidney strategy. And the Admiral is actually a physician, a critical care pediatric intensivist, so has also seen firsthand both the challenges and difficulty of families considering whether to do donation, as well as the challenges that families and children face when they're in need of an organ. So you've got a lot of critical mass of people who care about this issue and understand it on a personal level within the Department of Health and Human Services. And this is important because, as Rob explained earlier, one of the biggest barriers that we've had historically is getting our arms around what might this bill cost or save, and identifying the patient population that would be affected, what would this ultimately look like when the bill comes over to the federal government. These have been difficult questions to get answers on historically, but now that there's a sense of urgency amongst the top leadership, they can help us as a community procure answers from HHS and from Medicare that then help us drive this policy across the finish line on Capitol Hill. So, the last 6 months has been very busy in the Department of Health and Human Services on this specific front. So in early February, a number of groups in the room, RPA, AAKP, ASN, and others, actually had the opportunity to have a meeting with Secretary Azar and Adam Bowler and Admiral Giroir to talk about what do we see as some of the biggest barriers in kidney care in general and in transplantation in particular. And we actually raised this challenge of the Congressional Budget Office always says this costs a lot of money, but we think it's because they don't have very good data about who the patient population is that would need to take advantage of the lifetime coverage because they don't have insurance through their employer, through an ACA individual marketplace, or otherwise. So I think they took this to heart because in March, just about a month later, when Secretary Azar testified in front of the Labor, Health, and Human Services Subcommittee on Appropriations, he was asked a question by Jamie Herrera Butler, who, as many of you know, is a member of Congress from Washington whose daughter was born essentially without a kidney and who was a beneficiary of a transplant from her husband. she asked the secretary about this issue. I know many folks in the room had been whispering in Congresswoman Herrera-Butler's ear about this as an issue. And she took the opportunity of having the secretary at this appropriations hearing to say, what up, basically? Is this a priority for you? And what are you going to do about it? And the secretary was prepared with an answer, and he said, check, this is a priority. It's a personal priority. And the Office of the Actuary within Medicare has done a preliminary analysis that actually shows that this policy change of lifetime immunosuppressive drug coverage would save the government money. And I'd be happy to send it to you, Congresswoman. So that was a huge, huge sea change. Previously, no one in the government had ever been willing to say that this policy change would save money. Probably the biggest obstacle to getting this thing across the finish line. So it was a little bit of time before we actually saw that report, but in the intervening weeks, there was a broad stakeholder meeting at the White House with the Office of Domestic Policy Counsel to talk about the importance of extending lifetime immunosuppressive drug coverage and to answer a set of very difficult questions from people at the Office of Management and Budget. And as you heard Paul say in his opening remarks, you know, it's critical and has always been critical to have the Office of Management and Budget, which provides advice to the White House and looks at cost issues, understand the importance and kind of align with your viewpoint if you want to get anything done. So that was an important and positive conversation in April. More recently, in May, we were, as a community, gifted not one report, but 2 reports coming out of the Department of Health and Human Services that both show cost savings. So in the right-hand side here, the little CMS logo, that's the report from the Office of the Actuary that Secretary Azar talked about when he testified to Congresswoman Herrera-Butler. This report shows that over 10 years, expanding lifetime immunosuppressive drug coverage would save $300 million. Yeah. The last time we got an estimate on what this bill would do from a financial perspective, it was going to cost about $400 million. So this is, I think this reflects many different factors, including reduction in the cost of drugs, expansion of insurance options through the Affordable Care Act, and a number of other factors, but that is a big win. There was a second report that also came out from the Department of Health and Human Services Assistant Secretary for Planning and Evaluation, ASPE. We do love a good acronym. So ASPE said, we're gonna be super, super, super conservative about this. I actually think they used the word conservative 12 times in a 6-page report to underscore just how conservative it was. And they said, we think that this lifetime immunosuppressive drug coverage would save $73 million over 10 years. Okay, it's less than 300, but we're still in the black. And what's important is that the ASPE report underscored that the more people who took advantage of the benefit of lifetime immunosuppressive drug coverage, the more it would save. So the trend line is positive. So they're conservative, but that's kind of your floor for savings. So I think these reports give us as a community real ammunition to drive rapid change in Congress and get this bill across the finish line, because now we don't have to figure out how to pay for it. In fact, we can give it to committees of jurisdiction and let them use the savings from this bill to pay for other priorities that they have. So this is a real opportunity for our community to sing the praises of the right policy now also coming into the black. And as Rob alluded to, there is strong bipartisan collaboration on Capitol Hill with a group of champions who so deeply understand this issue because they've been working on it for years. Frankly, probably longer than any of them or any of us want to be working on it. It's time to get this across the finish line. So just to give a quick shout out, Dr. Michael Burgess from Texas is the lead Republican on this issue, and you know, Rob could tell the war stories about how he gets fired up about this, but suffice to say, I don't think we could ask for a better leader on this issue. Over in the Senate, Bill Cassidy is going to be the R lead, also a physician who really understands this issue deeply. Ron Kind, back in the House, is the Democratic lead. And Senator Dick Durbin, the whip, so we've got a good leadership angle here in the Senate's going to move forward. Rob had mentioned a meeting that we participated in along with Peggy and Troy and Scott and others in the room yesterday where representatives from essentially all of these offices all got together in a room to say, what is our strategy moving forward? How are we collaborating with one another? How are we leveraging these reports and other data from CMS to talk with the Congressional Budget Office to make sure they agree that this is going to save money. So really, you've got collaboration at the highest level going on Capitol Hill, as well as engagement with the community. The Senate Finance Committee, the House Ways and Means Committee, and the House Energy and Commerce Committee are the committees of jurisdiction on this. And we know that they're actively looking at this issue and see it as a long-standing priority. I think the most likely scenario for a bill like this immunosuppressive drug coverage bill, which in the grand scheme of things is pretty small, is that rather than being passed as an individual piece of legislation by itself, most commonly it would get wrapped up into a larger package of bills that are all moving together with a sense of urgency. So I think the staff on these committees are already thinking about what are big packages that we could pull in the immunosuppressive drug coverage legislation to make sure it gets across the finish line quickly. I've already alluded to this. There's broad agreement within the community and all of the organizations on this slide, as well as many organizations that are not listed here because I just ran out of time, and that's a lot of logos to put on one slide, are all aligned and speaking with one voice, led on Friday on the Hill by RPA, with this as one of their lead signature issues. So again, shared sense of urgency to get this legislation introduced now that we have these reports, leverage these reports and additional data from CMS to actually get that score from the Congressional Budget Office, who are the ultimate arbiters that the thing saves money. It really does come down to their decision and whether or not they agree with the two reports put out from the administration. But again, we've never had this good of an opportunity going into having the Congressional Budget Office look at this. Our job then as advocates, everyone in this room and everyone who's following along on social media, is to add a bunch of bipartisan, bicameral co-sponsors and elevate the sense of urgency on the Hill. Continue dialogue with the committees of jurisdiction and listen to their ideas about where they want to stick this provision in a larger package. I think there's been some talk that drug pricing legislation might be one home for this. There's been talk that this extenders package that is going to extend some revisions to tax law might be another home because that has to get done. You always want to attach your bill to something that has to get done because there's a good chance that Congress might get in its own way and not get it done unless it has to get it done. And even then they sometimes don't get that done. But so you're probably thinking like, sweet, we got this in the bag. What could possibly go wrong? But I do think there are a couple of missteps that we as a community just need to be aware of so that we avoid them. I think the general theme here is we need to keep up the sense of urgency on this. We've got these reports. These reports are not going to be fresh forever. Data changes. We've got a supportive administration that wants to help drive change on the Hill. And we've got a unity within the community that I don't think is ever in jeopardy, but it's time to capitalize on that. So I think if we fail to swiftly introduce the bill, we might miss the window for the Congressional Budget Office to actually say, oh, we agree, this does save money. And then we miss the window to attach the bill to other provisions that have to move that Congress is going to be passing later in the year. I think we've never had data this good that says that there are savings and that we know what the population of patients who will be covered by this extension of benefits, even though don't tell Republicans I said that, is. If we miss the chance to leverage those reports to influence CBO, we've squandered our best opportunity in like 2 decades. Again, if we delay the introduction to the fall, or if we delay the introduction to 2020, we're then running into presidential election politics. There's possible turnover amongst our champions within the administration who really helped to procure this OACT and ASPE report. And just generally, if we start to think that time is not of the essence, we are going to miss a really unique window, possibly the best window our community has ever had to get this across the finish line. So as a community, I think we all are rallied together, and we can continue to rally you and your friends, neighbors, colleagues. The time is now. We got to get behind these reports, thank the administration for helping to procure them, prepare to thank our congressional champions for their continued leadership on this issue, and just rally everyone you know to get behind this and create that sense of urgency to enact this and enact it quickly. AAKP is a long-standing champion on this issue. RPA is a long-standing champion on this issue. NKF is a long-standing champion on this issue. All of the logos you saw on previous slides are champions, and if you're not already involved with one of these groups, I encourage you to get involved and lend your voice to the broader initiative. So I'm optimistic. I hope you are all optimistic, and look forward to hearing from Dale and to a panel discussion. Thank you.
Thank you.